all for coming. Oh, okay. Thank you all for coming in today to see the Alzheimer's presentation on understanding Alzheimer's and dementia. We have Ron Evans today and Savannah Levine from the Alzheimer's Association. And I'm going to go ahead and turn the meeting over to Savannah. All right, thank you, Savannah.
Thank you, Melissa. So I'm Savannah Levine. I'm Program and Education Specialist for the Alzheimer's Association California Southland Chapter. We do cover all of LA County, and I'm so happy to be here today. I also wanted to let you know that June is Alzheimer's Awareness Month, Brain Health Awareness Month. So it's very appropriate that we're talking about this topic this month. And I'm going to go ahead and give it over to Ron Evans, who is our community educator for today. And he is going to talk to you about understanding Alzheimer's and dementia while I'm going to share my screen and he'll introduce himself.
Okay.
Thank you, Savannah. Here we are. Good afternoon, everyone. On understanding Alzheimer's and dementia, it's a presentation that we frequently are asked to give as an education because the two terms are often confused. Let's go ahead and go straight to the next slide. So what we're going to be talking about today is what is Alzheimer's and is it the same as or different from dementia? How does it affect the brain? What are the risk factors? What are the stages of the disease? What FDA approved treatments are there available for treatment of dementia? And what's going on with research? And then we'll talk a little bit about the support services that are available from the Alzheimer's Association. And so what we want to do to begin with is make sure that you understand what the impact of Alzheimer's is with some information. Let's go straight into the next slide. And taking care of yourself or taking care of somebody with dementia is a huge challenge. How much do we understand about this? How much do you understand? So here's a question. How many Americans are currently living with Alzheimer's? There's some options there. If anyone would like to type something into the text, the chat, you're welcome to. If Savannah is seeing any responses, go ahead and pick what looks like the most popular response. And let's see if somebody can get the right answer.
None have come in yet, but we'll give them, oh, we've got something.
Okay, let's go with what Bob
12
suggests.
million.
And not quite. So what
Does everyone know that they can use the chat feature to put their answers in? That's kind of, I think, I just want to remind everybody to do that.
Yeah, you're welcome to. So we got 5.8 million as another guess. And this is the correct answer. So Bob, you were actually accurate for some time very soon in the future. But at this point, we are past the 6 million mark because this slide has not been updated in a year. And we're waiting for some new figures to come. Every 5 years, we get a full update. And in between, we kind of get partial updates. But our slides and presentations are often running a little bit behind. So there's a lot of people, 5.8 million, 7 million, or 6-7 million, which is probably where it is right now. Let's move to the next slide. And how many people are looking after people with Alzheimer's or dementia? Caregivers. Many of them are unpaid. They're family members. Anybody like to pick one of those answers as to how many caregivers, unpaid caregivers? That's not the professionals in nursing homes, but just people looking after somebody who's at home. Okay, well, let's pick a middle number, one of those two middle numbers. Go for it, Savannah. There we go, 8.5, we're close. No, let's go with 13. No, let's go to 16. Well, yes. So there's a lot of people, probably closer to 18 or 20 million right now, people who are unpaid for caring for somebody with Alzheimer's or some other form of dementia. Let's go to the next slide. So click on the video and we'll get some facts from an expert. So the latest figures actually are posted on the Alzheimer's website, alz.org. So what is Alzheimer's and dementia? Let's go to the next slide. Are they the same thing or are they something slightly different? And again, we've got a couple of questions to get us all involved thinking about this thing. Is this a true statement or is this a false statement? Alzheimer's is part of normal aging. Is it true? If you just want to type T or F in the chat, that would be nice.
I haven't gotten anything in the chat yet.
Okay.
Oh,
So there we go.
have something.
False. Let's go with false. And the answer is correct. Congratulations. Yes. What Alzheimer's is a brain disease, and it causes problems with three major areas of the brain: memory, thinking, and behavior. And it is not part of normal aging. And skipping to the next slide, we have another question. And again, it's a true or false response. Can people younger than age 65 get Alzheimer's? True or false? Somebody saying true. And Charlene and others have got it correct. Approximately 200,000 Americans under age 65 are living with younger onset, also known as early onset Alzheimer's. In fact, these people are typically in their 50s and some in their 40s. Moving along. Now here we're actually going to hear from the experts rather than just the figures that were provided by experts. So our first expert today who's going to share is Dr. Snyder.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So there are different types of dementia and they are named after the cause, and Alzheimer's is a disease that causes dementia. Let's talk about, go ahead and click the video. So we'll talk about early and accurate diagnosis.
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So Gail actually had a different type of dementia, Lewy body, which is one of the four most common. But there are other types of dementia. Alzheimer's is the most common cause. It accounts for about 2/3 to 70% of all of the diagnosed cases of dementia that are of the category that's long-term, progressive, degenerative, and cannot at this time be cured. So dementia is a general term that we use. It's what I describe as a medical or a healthcare condition that we suffer from. Just a bit like having a headache. You can have different types of headache. Here we have different types of dementia. And Alzheimer's is not a part of normal aging, and as mentioned, progressive and degenerative. Move along. So let's look at the brain and get an understanding of what's going on. And bring up Dr. Hartley.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So today we have scans that allow us to see what's going on in the brain, but back 100 years ago, Dr. Alzheimer did not, and he was reliant, unfortunately, on having only to assess what caused the person to die and what caused the person to have struggled with what we call dementia. And Alzheimer's disease causes the nerve cells to die, and it's caused by formation of plaques and tangles, which are proteins that the brain does not need to have there. They basically gum up the works and cause a degeneration of what goes on in the brain, which is based upon neurons. The brain changes result in, initially, we see memory loss, but we then start to see the person can't think as logically and creatively as they used to. They can't do things that they used to be able to do. Simple things like making change, balancing their checkbooks, as well as having lost their memory and unable to communicate because they can't recall words and so on. And later stages, they start to develop behavioral issues, which can become real challenges. So let's move to the next slide. And talk about risk factors. So we all want to know what are the risk factors. Let's go to the next slide, which is going to give us a choice of several things to look at. Again, it's one of those participation opportunities. If you would like, here are several categories: genetics, family history, and age. Put a G, an F, or an A in the chat if you would like to pick one of those as being the highest risk factor. Nobody wants to guess. Oh, there we go. We got an A. Let's go with the A. And we got a good crowd today because, again, we got the right answer first time. Excellent. So Alzheimer's is not part of normal aging, and yet age is the greatest risk factor for the disease. Typically, it's people in their mid-60s and later that have the increasing risk, and the risk gets greater and greater every 5 years. And by the time we're in our 80s, we have about a 30 or 35% risk of having Alzheimer's. And I'm one of those, I come from one of those families with people who are in their 80s and 90s. And unfortunately, we're seeing it happen. So we know it occurs in the 80s, and it definitely can occur and be held back as late as for somebody in the 90s before it appears. Let's move to the next slide. So we're going to hear again from Dr. Snyder, and this time she's going to talk about these risks and the risk factors, give you another technical, semi-technical, but not too deep explanation.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So who is at risk? Well, Dr. Snyder explained that age is the biggest factor. Family genetics, when we see a pattern within a family, we know those members of the family are at higher risk. But what about our ethnicities, our backgrounds? Hispanics are about 1.5 times as likely as Caucasians to develop Alzheimer's. African Americans, even higher, at twice as likely to develop the Alzheimer's disease as Caucasians. And amongst the entire population, almost 2/3 of Americans with Alzheimer's are women. But women, we know, have always lived longer in just about every culture we know of. So is it just because women live longer that we have a higher percentage of them as being struck down with dementia, Alzheimer's or another kind? Or is that not a coincidence? But let's go and have a look also at the next slide. And this is going to take us into a little bit of maybe a better understanding of what are the risk factors. Dr. Snyder talked about risk genes in addition to age and having a parent or a sibling, a family member that has exhibited the disease. So risk genes and deterministic genes. Risk genes, as Dr. Snyder explained, simply increase our risk. They say, yes, you're more likely to, but you're not guaranteed. Deterministic genes are the ones where if you have that gene, you are definitely going to have it. It's a bit like having, in these days, we can talk about the COVID-19 test. You either are tested positive or negative. And there are very, very rare cases of deterministic genes associated with Alzheimer's, but they are extremely rare. So dominantly, we're looking at risk genes and AEO genes are the categories that we hear about. APOE3, APOE2, and APOE4. APOE2 and 3 are not considered risk genes for Alzheimer's, but APOE4 is considered a risk gene for Alzheimer's. All of us have two genes, one from our mother, one from our father. If you have one APOE4, you have an elevated risk. If you have two APOE4s, then you have a double elevation in risk. Doesn't guarantee, because you can get Alzheimer's even if you only have APOE2s and 3s, and you might not get Alzheimer's even if you have an APOE4 or even two APOE4s. And again, as to recap, Hispanics, African Americans, and women are at an increased risk for Alzheimer's compared to the entire population. So let's go to the next slide. And talk about the stages. It is a progressive disease. So bring up the next video, or the next slide rather. And here we've actually got a set of videos. Start with the video in the middle that does the big arrow there. Does everyone living with Alzheimer's experience the same early symptoms?
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
And so let's have a look at what living with Alzheimer's feels like from the perspective of 4 different people. Just play one of these, one after the other.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel. So I've even stopped trying.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor, and so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So if you are comfortable using chat, give us a thumbs up if you felt that you identified with any of those people and the challenges that they just explained to you and articulated. And then we're going to go back and hear again from Dr. Snyder. She's going to help us understand the progression as things move along from the early stages, and all of the people that we just heard from are all in early stage. Go ahead and click.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So Dr. Snyder has just walked us through the progression from early to middle and to late stage. These stages are referred to as mild, moderate, and severe because of the medical context of how easy or otherwise it is to look after a person. And she explained that no two individuals experience exactly the same symptoms and progression of the disease. Yes, we could list out the symptoms, but the order in which the symptoms occur and whether or not they occur for an individual varies tremendously. So as a person moves from a moderate stage into severe, their symptoms have worsened over time. People progress through the different stages at different rates. In other words, some people have a short span of in early stages. Other people have a long span in the early stages. Let's move to the next slide. And here we're going to talk about treatments. So what are the treatments that are available? What is there that the FDA has approved thus far? Go ahead with that slide. Yeah. So we got a quick question just to see what your current knowledge level is. Again, it's a true or a false. There are several drugs that are available to slow down the progression of Alzheimer's disease. Is that true or is that false? We would all like it to be true, of course. Okay, go ahead and click on true. And unfortunately, it's not. So there's no treatment to prevent or to treat or slow the Alzheimer's disease, but there are several drugs that are available to address some symptoms. False was the correct answer. Let's go straight into the next slide. And here we're going to have Dr. Hendricks come back, and he's going to talk about the situation, actually the situation that existed up until fairly recently and has existed for about the last 5 or 7 years. Go ahead.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that's modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
Go straight to the next slide. So there's 3 types of drugs, Aricept, Exelon, and Razidine, and Namenda, the 4 names of the individual drugs. Namenda was identified as slightly different in terms of what it does and the way it functions. And that drug is combined with typically with donepezil, which is, Namenda is combined with one of the others in order to give us the Aricept, which is donepezil, and Namenda, mematine, combination, which is called Namzaric, and that is used typically just in the late stage. These treatments only address the symptoms, though. They help the individual to handle the symptoms, and they help the caregivers to manage this whole situation. They don't, unfortunately, treat the underlying causes, and so they're not doing any repair or reversal of the disease. Let's go into the next slide. And that leads us into talking about Alzheimer's research, where great sums of money are required. Let's go ahead and go to the next slide. And the Alzheimer's Association is very active in trying to generate funds for research. So click on each of these 4 slides, videos, one straight after the other.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease is a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
And go to the next slide. So clinical studies, we're going to hear from Dr. Fargo.
More important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA approved drug, to that effective treatment, and maybe someday even a cure.
So clinical trial studies are key to advancing Alzheimer's research, and you'll actually hear 3 different terms: clinical trial, clinical study, and a clinical research. So what's the difference between a trial, a study, and a research? Well, studies involve both, really is an umbrella term, you might say, for trials and research. So a clinical research program does not necessarily involve having a drug administered. I, for myself, have been involved in 2 programs, both of which started off as just clinical research. I don't have dementia, and they weren't offering to give me a drug at all, except after screening. I was then transitioned from a clinical research program, which just goes on from 1 year to the next, into a short-term clinical trial, in which case I signed some documents to say, yes, I would like to take this particular experimental drug. And so now I was involved in testing a medication. Both of those programs have been terminated and put on hold or whatever. Somebody has asked the question, what about diagnosis? And early on in the presentation, we emphasized early diagnosis was really important. And the question posed is, does a diagnosis of mixed dementia mean combination of all types? It means a combination of 2 or more. So it can be Alzheimer's with Lewy body, for example, or it can be vascular dementia with Parkinson's or something like that. So I don't know if that answers the specific question adequately, but it gave me the opportunity to explain, yes, the testing can sometimes point at more than just one possible cause. But the important thing about early testing, early assessment, is to make sure that if you are going to be treated, you're being treated for the right thing and not the wrong thing. And we have some very, very hot off the press news that we want to share right now. And it's to do with a drug that has just been approved by the Food and Drug Administration for the United States. It's a different category of drug to the ones that was explained by Dr. Snyder. It's the first therapy that actually demonstrates that removing amyloid from the brain, which is one of the proteins that Dr. Alzheimer's identified, can delay decline and deterioration in a person's living situation if they have Alzheimer's. The drug is called aducanumab, and it will be marketed as Aduhelm, H-E-L-M. It would have been nice if it had been H-E-L-P, Aduhelp, but it's Aduhelm, A-D-U-H-E-L-M. That's the trademark name. It has been approved by the U.S. Food and Drug Administration, and it's administered intravenously. That means IV, via a infusion, which takes 45 to 60 minutes, and it has to be done monthly, and it is not available widely, and it is not inexpensive. As far as I understand, it is only private paid at the moment. Insurance companies are going to have to evaluate whether or not they're going to cover it, and so on. But it is the first approval of a drug in a new category that has the potential to really benefit people who are living with the disease. It's been tested only in people with early Alzheimer's disease and mild cognitive impairment, which is referred to as MCI. So the first screening to see if you would qualify for it, if you were interested, would be that you have to be scanned, and the scan has to show evidence of elevated amyloid plaques in the brain, and have no information at all about plans for testing with people with more advanced cases of dementia. But at this point, it has been approved for use with people who just have the early stage. And the hope is that at least we can delay the advancement of the progression of the disease to deteriorating one's ability to function. So having explained that, the next slide that we have up, Savannah, is which one? Remind me.
Well, let's go over trial match actually, so that the individuals can learn how to sign up for trial match if they're interested in a clinical study.
Oh, yes, thank you.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
Okay, great. So we want all the help we can get. Scientists now actually have some new optimism, given that they now have a new category of drug that operates in a different way. Just as with COVID-19, we ended up with multiple drugs that didn't all operate exactly the same ways. And it's going to be interesting over time to see how that pans out. But both drug and non-drug studies, which I referenced, are taking place all across the country. And you can go to alzheimersalz.org website, look for Trial Match, and they can help you get connected into free clinical studies, whether or not you feel that you are a candidate for Alzheimer's or not, whether you are showing symptoms or not. They need people who are fit and healthy, as what they call I've forgotten the term. So do I have any few early stage problems? Yes, just a few. So far, nothing serious. So that's how we can help you through the website, and Savannah's going to take over and talk more about the Alzheimer's support that's available.
Thanks, Ron. So we are the Alzheimer's Association. We are a nationwide nonprofit serving communities across the country. So let's take a look at this video. So as you can see, we're located across the United States. Our mission as the leading voluntary health organization in Alzheimer's care support and research, and our mission is to eliminate Alzheimer's disease through that advancement of research that's so important that we've been talking about, to provide an enhanced care and support for all those affected, and then to reduce the risk of dementia through that promotion of brain health. And like I said, we are in Alzheimer's and Brain Health Awareness Month. And our vision is a world without Alzheimer's disease and all other dementia. I want to make sure that's very clear because as Ron mentioned, dementia is an umbrella term and Alzheimer's is the most common form of dementia, but we do support individuals with all forms of dementia. So I want to talk to you today a little bit about our key resources. So we are available whenever and wherever you need support. I am part of the care and support team. It's very important to me that you know some of our main resources, and one of them is our 24/7 helpline. It's in over 200 languages. You can reach someone day or night, 365 days a year. You talk to a master clinician on the other side of the line who can give you information on the disease, emotional support, can provide information on the stages of the disease, help you with referrals, and so on. It can be for professionals, family members, caregivers, and of course those who are affected directly by the disease. So we're going to hear from someone briefly who kept the 24/7 helpline on his favorites.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
So then we have alz.org, which is our website. I highly recommend you take a look at it. We have information that's a safety center. We have a caregiver center, of course, a center for those who are affected directly, professional resources. So lots of information there to explore. So please do. We also have a local website, which is actually alz.org/SoCal. alz.org/SoCal is all our information about our events, education, support groups, etc. So let's hear from someone who accessed that information on the website.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this, how can I handle this, is there more people like me out there, is there someone that I can talk to if I need to. And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And then I wanted to talk to you about our last resource, which is the Community Resource Finder. And you can find that at alz.org/CRF, stands for Community Resource Finder, by zip code. You can find in-home care, elder law attorneys, neurologists, and it's really an incredible resource. That's a free partnership that we have with AARP. So we are in communities nationwide. We also have our local offices. I'm part of the San Fernando Valley Regional Office, and you're always able to call directly to the office as well. So let's hear from someone who utilized those resources.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
Okay. So now I'm going to talk to you about ways to join the fight. There are a lot of ways that you can join the fight with us. We've already mentioned some already with regards to trial match and getting involved in a clinical study, but you can also become a volunteer. You can become a volunteer for a lot of different parts of the association. We have programmatic volunteers like becoming a community educator or a support group facilitator, or you can be involved with the walk planning committee in your local community. So there's lots of ways to volunteer at alz.org/volunteer. We, of course, throughout the pandemic had virtual opportunities, and we are going to transition more into hybrid opportunities. So if you still want to do virtual, eventually we'll have more in-person opportunities. So a great way to dedicate your time. We also have advocacy, where we have legislative efforts to speak out on behalf of the needs and rights of those affected by Alzheimer's disease. And you can find more information there at alzimpact.org. It's a huge arm of what we do. The trial match, of course, I'm not going to go into detail since we already reviewed it, but please check out alz.org/trial match. It is free, it's easy to use, and as Ron mentioned, you do not need to be affected by the disease to sign up. They are looking for everyone, and that just helps the research as well. We also have our walk, which is in over 600 communities across the country. It's the largest fundraiser to fight this disease. It's how we support a lot of our care and support resources as well as the research. So it's really important. We do have a San Fernando Valley Walk. You can sign up and find that at alz.org/walk. The link to register is available now for the fall. So I really encourage that. It's an incredible way to get involved. I'm actually going to hand it over to Melissa at this point. She wants to share a little bit about a special program that's being offered by Los Angeles. So I'm going to give it over to Melissa.
Thank you, Savannah. So I received a brochure through email today from the city, And I think what I'm going to do is, instead of sharing it with you now, I'll go ahead and send this to everyone that was in the meeting today, because I have your email. So I'll email you what this is. But basically, the city of Glendale, in partnership with the Alzheimer's Association, is going to be doing a virtual presentation on Tuesday, July 13th, in conjunction with LA Found. That's another organization, and it's regarding tracking bracelets. So you don't have to remember any of this. I will send this out to you later this afternoon or tomorrow. Okay, and I think with that, I'm going to stop recording. Let's see. Okay.